Today what we're going to talk about is management of acne scarring. I realized when I was looking at my virtual consultations there wasn't one appropriately dedicated to acne scarring. So I want to talk to you about my philosophy and my approach toward management of acne scarring. Acne scarring, for the most part, is a condition where you get pitting, where there's actually the normal skin tissue has been brought down, or in medical terms we use the word atrophy. That is almost just basically losing some of the skin texture and tone. It falls inward. You can have anything from tiny little holes, little pock marks, to larger ones that are sort of these large concavities that fall inward. It's rarely that it's actually a enlargement. Usually it's a falling away. What's interesting is that most physicians out there manage acne scarring in the exact opposite way that I do. If you think about what I just told you, the abnormality is that the acne scars are actually lower than the normal skin tissue. The traditional way of managing acne scarring is to go in there, sand it down, laser it down, and what they're sanding down is the normal skin to reach the level of abnormality. Now, why is that a problem? Well, number one, if you're dealing with patients of skin color that has anything darker than what we call a Fitzpatrick 4, you can actually lose skin color. That is a risk. In addition to that, you're taking normal skin down to try to reach the level of abnormality. That's very, very hard to do. I extremely rarely today use dermabrasion as a way to manage this. Just as a point of clarification, when I say dermabrasion, I don't mean microdermabrasion. Microdermabrasion is that little, little gentle, like a facial. It's almost like a scrub. Dermabrasion is actually sanding the skin down. If you look at some of the video testimonials, you'll see why I don't do it, because the recovery is extreme and the results are very minimal. So let's sort of categorize philosophically the two types of acne scars. There's a type of acne scar that's little tiny ones, and then there's ones that are rolling deformities. Let's talk about how I manage each of them, because it's a different strategy for each kind. The ones that are very, very tiny, I manage with a method called cross treatment, CROSS. It's from Korea. It's 100% trichloroacetic acid, so it's extremely strong. You cannot put this over the whole face, otherwise you will burn someone. I use this for only minute, tiny little holes, and I do this in patients even of up to a Fitzpatrick 4, which means a Hispanic or Asian skin. I wouldn't do it on an African American skin or a medium skin Indian patient, but someone from very light Caucasians all the way to Hispanic to Asians, and you may have seen some of the recovery journeys and testimonials about this in darker skinned patients as well. Again, appropriate for very light skin to about a Fitzpatrick 4, which means Hispanic, Asian, Mediterranean types. The way that I do this is, let's go through that sort of description. Remember that if you've got a little hole coming this way, most people try to sand all this down to reach the abnormal pit. That's a big problem, because you're taking all normal skin tissue down to the depth of the abnormality. What I do instead with the cross treatment is use that little punctate acid to bring this back up. And that's a very, very safe method to bring that back up. Now, the problem with it is it does require multiple treatments, spaced about 3 to 4 weeks apart. It's done as an office-based procedure. You walk in, you literally walk out. For people that fly into me, that come into me, you can literally take a flight back out that day. The only negative thing is that there is a recovery involved. There's twofold recovery. The first recovery is the fact that that week, the old skin, that little area is going to turn a different color like red. You're going to have to use a thicker emollient like Aquaphor to keep it healing appropriately. Then after about a week, the skin will have healed, and you can use lighter emollients like Cetaphil or Eucerin, and then go back to your normal activity. You're going to look a little unusual for about 3 to 7 days of having those little areas turn darker. Obviously, the recovery is directly proportional to the number of little holes that you have. You only got a few, it won't be as noticeable. If you got a lot, it's going to be more noticeable. Makeup can be used only after those areas heal. It's about 5 to 7 days out before you can do it. And if you're in town with me, I can walk you through when you can do it. I usually see you back a couple times that week the first time, and then the next session you come back a month later or 3 weeks later. I don't need to go in there and actually see you back every time. It's just really your comfort level. The second recovery portion of this is the fact that these areas, especially if you're darker skin, could hyperpigment. Now, hyperpigmentation means that the area turns darker. That's a temporary phenomenon, and unfortunately it can last even several months. If you ever cut yourself and you notice that area turns a little darker, it takes months to go away. That's a negative. Finally, there's one more negative, is the fact that it does take a while to see the results. About 90 days after the second or third treatment will you begin to say, oh, it's looking better. And the other negative is the fact that setting up realistic expectations with you, I'm not going to be able to consistently deliver a result up to 80 or 100%. It's usually about 30 to 70% improvement. The problem whenever I give a range is anytime I say 30 to 70, people always hear 70. So it is a range. I can't promise you perfection, only my best effort. And acne scarring is one of those very frustrating treatments where you never get closer to 100%, and that's a sad thing about it. But if you look at my before and after gallery, you can see that I get pretty darn good results. Let's talk about the one that's a little bit more immediate gratification. I use silicone treatments, liquid silicone. It is an off-label treatment, meaning that the FDA has currently approved it for use in the body for retinal detachments in the eye. I'm using this through an off-label arrangement, which means that it's completely legal. You just have to understand the risk, benefits, limitations that you're doing. When I do acne scarring with silicone, the benefits are very, very apparent fast, and that's very satisfactory. And the recovery is a lot shorter, on the order of maybe 2 or 3 treatments, or even 1 treatment, you start seeing a result. The reason why my silicone doesn't lump up and migrate and cause problems down the road is, number 1, I'm only using medical grade product. Number 2 is the fact that when I do this, I use very small micro droplets, and I build this just like what I was telling you about, the cross treatments, over a period of a few months. It's going to take me 2 or 3 months to get you there. If you're from out of town, I have a lot of patients from out of town having their acne scars treated. I can work with both the cross and the silicone the same day, so long as they're not exactly overlapping in the areas. And that's actually quite fortunate, because most people have little tiny dots in one area and they have larger deformities elsewhere. And I can work in those 2 areas concurrently. The silicone, as I said, you'll get a much faster result with very little recovery time unless you have a little bruising. If you're in town and you do have bruising, I can laser the bruising down within a period of 48 hours. I usually wait for about 5 to 7 days before I do that. And then the cross treatment with the little microacid treatments, you're also waiting for that time for the result to show up, and it's going to take me probably about 6 months before you start getting happy with what I can do for you. And you may need more than 3 to 5 treatments. On average, I would say about 3 to 4. I have a few people that require up to 6 to 7. I've done hundreds of these. I get very good results in all skin types. And also the silicone, to let you know, you also see a wider defect, and you can't acid treatment that, otherwise it actually gets worse. Little treatments, it gets better. Bigger treatments, worse. So what I do is I use a silicone to actually raise all these depressions. So hopefully that's clear to you, and I use sort of this 2-pronged approach attack depending on what your pathology is. And I hope that was clear for you. It was just an introduction. Since I treat acne scarring so differently from all my colleagues, and my results are pretty good, as you can see through the testimonials in the before and after gallery, I wanted to have some explanation before you come to see me, and hopefully answer some of your questions before you come to visit with us. And thank you for your attention.